The Mundinger study is one of the 3 studies that the Cochrane Library has included in their studies when they look at this question of replacing physicians with nurses. And it's one of the 3 done in the United States. And according to Mary, it was done with independent nurse practitioners, which we know at that time in New York that it was a state where supervision was required for non-physicians to work with patients. And so I'm just going to break down the study basically from top to bottom. And I've pulled this not only from the study paper, but I've actually gone through a book that Mary wrote about the experience. And they call it the Columbia Nursing Experience because it started an entire clinic. And she had the goal, interestingly enough, to give her some credit. She sort of foresaw the shortage of primary care physicians, and she had her own thoughts about what the proper answer would be. And I would say that some of us feel more strongly that increasing residency slots and increasing primary care physicians across the country is probably a great solution, but this was kind of her solution. And so in a nutshell, she actually said activism needs to be based on empirical evidence. And so it's kind of ironic that here we are talking about empirical evidence that she did in her study. And the goal was to increase a nurse practitioner education because she thought it was a far better investment than opening more medical schools. So with that, the study subjects in her study were predominantly Hispanic women immigrants in their 40s from a community with a population of about 200,000. Half were at or below the poverty level, and severe illness occurred very infrequently in this population of kind of mid-40s women, which actually Rebecca and I are both in that category right now. So it's kind of ironic that we're talking about this tonight. 30% spoke little to no English, and 40% of the study subjects didn't complete high school. And the duration of the study was rather short. It was about 6 months in time. 60% of the study sample was seen between 0 and 2 times over the 6 months. So we're not really talking about chronic conditions that were seen on a monthly basis. We're kind of talking about people who were seen once or twice over that time period in the clinic. Now, all patients, it's really important we understand, were what's called ambulatory care sensitive, which means they were kind of I don't want to say simple, but they had simple conditions that were diagnosed in an emergency room. And in general, those conditions were type 2 diabetes, asthma, and then hypertension, which is high blood pressure. So most of these study subjects that were enrolled came by referral through the ED at Presbyterian Hospital or a specific local urgent care in the same area. This study did not include the evaluation, diagnosis, and treatment of what we would call undifferentiated patients, meaning patients who kind of came with different complaints, and we had a smorgasbord of things to work up, which is something we see in primary care clinics today. So interestingly enough, of the adult patients that were seen, 17% of these were routine annual exams, 10% were seen for hypertension, and 7% were for regular women care. Interestingly enough, the pediatric patients, 66% of the visits were seen for well child checkups. So really basic pediatric care. We're not talking about sick children. The staff were interesting. This was not originally listed in the study, but I've found this as I've done more research. There were 4 family nurse practitioners and 3 pediatric nurse practitioners working 4 hours per day, 4 to 5 days per week. So we're talking really about part-time nurse practitioners. They weren't working in a full-time clinic that was running 8 hours a day, 40 hours a week. All of these nurse practitioners, and this is really important, were assistant professor level. They were all appointed by the faculty to the Columbia School of Nursing. So we're talking about the top of the top in education. And actually 3 of the 7 had doctorate nursing degrees or doctorate level nursing degrees when they enrolled in this study. One was the director of the geriatric nursing program, one was the director of adult nursing program, and one was the director of the pediatric nursing program at Columbia School of Nursing. So all of the faculty NPs underwent a special, what we call residency training in dermatology, radiology, and cardiology. And they were mentored by physician colleagues to conduct and learn ER evaluations, as well as admit and co-manage patients. Now, what's interesting is there's no description of the physicians who were doing the training or whose clinic they were compared to. So we really don't have anything to draw from on the first period. Again, it was a 6-month study. And then in a nutshell, the outcomes were that there was essentially no difference in care or outcomes. And I think I'm just going to let that sit there because I think finding a difference in 6 months in women in their mid 40s, I'm not sure there are many studies that would find a huge difference. You're not going to see a lot of deaths basically from high blood pressure in women in their mid 40s. And I think that's a fair way to kind of look at the study, as well as if you're doing 2/3 of your care is well child care. I'm a pediatrician. And I would say there's few pitfalls when you're seeing well child checkups. You will pick up things from time to time, but not many life-threatening conditions present during well child care. So again, I don't want to put into context that this was a pretty simple clinic with pre kind of decided conditions for those who had conditions, and the rest were healthy.